following is a Sketch Media production.
The human body can grow life and sustain life and then exist normally after is kind of insane and amazing.
Absolutely.
But you need to recognize the amount of work that your body goes through.
Hey everybody, Dr. Shawn here with Easewell Chiropractic Podcast, and we have the lovely Dr. Erika Hoffner-Martin here with us today. Dr. Erika, I'm so happy to have you on here today. I've been so excited to hear your story and hear how you got started and what you're passionate about, and really the combination of how you've been able to help your patients with the PT care that you've been doing. And also, I remember us talking a while back about how you've even seen chiropractic and PT going well together. So I really wanted to have you on, discuss how those kind of relationships work with co-management. And I also wanted to bring up on how you work very closely with pelvic floor. So I wanted to really touch on this episode and bringing in a good bit of women's health, but also maybe even bring in the importance about pelvic floor health for even men as well. So I do appreciate you taking the time to be in here, but go ahead and get us started. Give us an intro. Tell us about yourself.
Thank you so much for inviting me. I was very flattered that you asked me to be a part of this. But I have been a practicing physical therapist now for 5 years, so I'm still relatively early in my career. But since I graduated, I've been in the outpatient setting and mostly focusing on pelvic floor health. Mostly women, but I treat men as well. And that has now kind of morphed into pelvic floor mixed with sports and orthopedic injuries, mixed with treatment for hypermobility dysfunction. That's also become a newer subspecialty of mine, partially because I have a lot of these conditions myself. So it's just made it easy to transition and be able to treat people based off of what I've also experienced as a patient too.
Yeah, absolutely. I've come to find that too. It's like when you go through it yourself, you kind of know a thing or two about how to not only help yourself, but also help that other person with it too. So
Exactly.
I'm really glad that you're able to find something to be able to help others and not just say like, oh, well, I got this, let's just deal with it. And now you're able to turn it into a passion for helping others. So that's awesome.
Yeah, I think it's made it a lot more enjoyable though, knowing that I'm proof of being able to get some of these issues, if not completely fixed, at least very much managed and not interfering with your day-to-day life.
Absolutely.
And that's, for me, I think that's the main goal. It's not to fix people, because a lot of the time with chronic pain, we're probably not going to get rid of it 100%, but that doesn't mean that it should be interfering with your day-to-day life.
Absolutely.
You shouldn't be noticing it all the time. And I think that's a much more realistic goal. And
I'm seeing that now with more practitioners setting more realistic goals. So I'm really happy to see that people are like, well, maybe I won't be at 100% pain-free, but that's not going to stop me from living my best life. And I think that's a much better rhetoric to kind of go into as well, instead of, we're going to cure you. You're going to have to me, it was always like, there's a little fluff of that there. And I think patients can kind of see through that. So I'm glad that you're realistic and setting goals that people can actually achieve and things like that as well. So we'll starting off into that. Is there any crazy interesting stories that you can share?
I've had a lot of medically complex patients, I guess, in more of my last 3 years working with a cash-based practice. I wouldn't say any specific ones stick out necessarily, but in general, I'm seeing anyone who comes in with pelvic pain, for example. Pelvic pain, a lot of the times, is due to hypertonicity of the pelvic floor muscles, trigger point presence. It can be referred pain. It can be a nerve issue, but the pelvic floor is probably not where that issue started. Pelvic floor muscles are way too small to be the ringleader and the ones running the show.
Yeah, that's what I want to. I want to have a stop in that and maybe break down a little bit of the pelvic floor muscles, maybe for someone that doesn't understand.
Sure.
I know a lot of people think they may know or just may not know at all. Is there a way you can break that down?
Yeah.
A way for a simple understanding there?
For sure. One thing that I've become very passionate about within this line of work is the education portion, which I feel like as a patient, if you don't understand how your body is supposed to work and what things should feel like, then being able to implement the kinds of treatments or exercises that I'm recommending to them is going to be way harder and may not make as much sense. Because the mind-body connection is, I think, the most important thing. We're trying to retrain the nervous system, not necessarily just retraining the muscles.
I love
you know, with the pelvic floor, because for women, at least, these are muscles that are basically living inside of a cave. So you can't see them. You can't really feel them. You're just going based off of what you think you feel internally. And until you've been given certain cues, whether that's verbal or tactile, it can be hard to make that connection. So for women and men, there's 3 layers of pelvic floor muscles. The entire bottom of the pelvic bowl is covered by muscle. And I think that's just something that not a lot of people recognize, is how much musculature there is down there. It's for women at least, it's one of 4 different layers of tissue that's actually truly parallel to gravity. So alongside the diaphragm, the foot intrinsic muscles on the bottom of your feet, and your vocal cords. So all 4 of those are going to play together and influence one another in how they function. And so the outermost layers of the pelvic floor are the muscles that are typically helping to close off the urethra, preventing any sort of urine leakage or any other incontinence that's not supposed to be happening. And they're also helping to draw blood flow to the erectile tissue for arousal. Second and third layers are typically doing more of the supportive role for the pelvic organs. So for men, because more of your musculature is external and you also have the added support of the prostate, it's typically a lot easier for men to be able to get these muscles to function. And it's not something that they're typically as aware of or needing to focus on as much, because you already have that built-in support system. Whereas for women, because things are more internal, we have shorter urethras, the anatomy is just built a little differently. We end up having to take into consideration a little bit more how our pelvic floor is working with the rest of our body. It varies person to person. It varies before childbirth to after childbirth. It can be influenced by maybe even what you ate that day, what other conditions you have. It's not very cut and dry, which I think is why I like it so much, though. It makes it a little bit more of a puzzle.
Yeah, I love that. I love that. So would you say that the exercises that you maybe do for male versus female, are they similar, or is there like a kind of difference between the two there?
For the most part, they're similar.
Okay.
When I'm evaluating a patient, I'm trying to figure out, like, let's take incontinence, for example. So unwanted urine or bowel leakage or stool leakage or gas leakage, any of those things that should not be coming out of the body when you don't want them to. For the most part, including women after childbirth, it is not normal to be leaking, with the exception of like the first couple of weeks of healing.
Right.
You still should not be leaking anything after that. And that's I think an old wives' tale that we've just been taught over the years and have just been like, oh, okay, I guess this is just what my life is going to be like now. And
maybe common, but not normal.
Exactly. And that's something that I try to really stress, is that common does not mean normal.
Absolutely.
So if this is caused by a tension-based issue, which for most of my male patients, that's what I find, it's overuse of the pelvic floor muscles. And I would say, honestly, for most of my female patients too, it's a lot of times overuse. The stretches and the exercises that I give are going to be the same no matter what gender you identify as or what, physiologic structures you have.
Okay.
Because muscles are still muscle.
Yeah,
you still have to treat them just like any other muscle in the body.
I think that's important to know, because I think sometimes the male versus female, males, will have the tendency, well, maybe it's not as important for me since I don't have those structures, things like that. So I think it's important to be able to hear that, like, no, you still have muscles there. It's still important to hear. But I also think it's important for females also to be aware of those muscles, because I'm a very big person and I really love preventative measures. So is this something typically you think you can have education with people on preventing maybe some pelvic floor dysfunction, things like that? Or is it something that you kind of just have to wait until a crisis to get taken care of? Or at birth, do you have to wait until after birth to start doing pelvic floor correction therapy? Or is that something you can do kind of preventative as well?
So as I feel like I talk about this all the time now. The way that our healthcare system works is not based off of prevention, which is how most like European countries' healthcare systems function on.
Right.
If you were to take a look at U.S. statistics for childbirth things, the U.S. has one of the highest maternal mortality rates out of any developed country. We have the highest C-section rate out of any developed country, and we have much higher postpartum complications. In Amsterdam, for example, we have a friend who lives over there, and she was telling me about her experience giving birth over there. When she, before she gave birth during her pregnancy, she was able to see a pelvic floor provider throughout the entire duration of her pregnancy, and that was just part of her health care.
That was just incorporated in
Exactly.
Wow.
Postpartum, same thing. You're pretty much guaranteed access to a pelvic floor provider. Your healthcare providers would come to you for your postpartum care and to help with like lactation consultations, giving your newborn their vaccines and their checkups. They're coming to you because they know the trauma that your body has just experienced.
Absolutely.
Pregnancy and childbirth is the most physically and probably emotionally traumatic experience that a human can go through. And that's not to say that it's something that, you know, I don't want people to do because I want kids myself. And it's just, I think something that I want people to recognize is that while, yes, this is beautiful and amazing and just a miracle in itself that the human body can grow life and sustain life and then exist normally after is kind of insane and amazing.
Absolutely.
But you need to recognize the amount of work that your body goes through. I'm a huge proponent, of course I'm biased, but I am a huge proponent of the preventative part. I feel like if we could take some notes from these other countries that have better statistics for childbirth, especially within the mothers, then we could be preventing and helping a huge portion of our population, of our childbearing population, from unnecessary issues after, and even maybe even prevent unnecessary deaths. And that's, I know it's been in the news and everything a lot more recently. And I think for me, you know, being at the age where I want kids and I'm ready for that, it's just something that's on my mind all the time now. And I think that's something, though, that both chiropractic and physical therapists have in common, though, is we want to try to prevent these issues from happening in the first place.
Absolutely.
If you can keep the neuromuscular skeletal system working in its optimum condition, and that means, you know, like getting checkups like you would go to get your annual physical or labs drawn, then we can prevent a lot of these injuries from happening in the first place. And that should be our goal as healthcare providers, instead of waiting until something happens and then trying to rewind it. That just, it's not as effective.
Yeah, I've always liked the story of it makes more sense to prevent people from going off the cliff rather than to have an ambulance at the bottom. You know,
Yeah,
like,
that's a good analogy.
like, let's
Exactly.
just maybe not have people go off the cliff, and
Right.
you don't need the ambulance at the bottom. So I'm glad that we're like-minded in that, and I see a lot more healthcare practitioners becoming that way because I really see now human life, the longevity of it. I see people from time to time, they'll start to do these I'm trying to live till 200 years old, and they're taking all these extreme lengths now. And so I think it's really fascinating to see what lengths people are doing now to keep as much quality of their life instead of just now being like, yeah, I got 50, 60 years if I'm lucky, you know, and just kind of ride it out to then. Now I think people are actually more optimistic about being 60, 70, 80, 90, and 100 years old. So I think that prevention stuff comes in handy. And just seeing what the female body goes through, like you said, that speaks volumes on the strength of a female and what they can endure. I saw it firsthand with my wife, and I already knew she was a badass, but I mean, she is an absolutely rock star in my head after just watching her go through that. So I really do have even more of an appreciation of women and what they go through after even seeing it firsthand. So I do think every man should probably see firsthand what it actually happens, like actually the process, so they can get a general feel of, okay, I do have empathy for this woman. I do want her to get to a physician that does have this experience and this practicality of being able to get my wife back into that normal as possible. I know when I got to bring my wife to see you, I was so happy to see the difference, just the energy levels change, her like actually wanting to get back into the gym and working out. Like it was just amazing to see that difference. So I really love that we were able to connect on that level and see that progress through. But that brings my hand up too with how chiropractic, we were talking about how we both focus on the nervous system. So is that something that you do get to see from time to time? Is people already under management with chiro, and then they're like, okay, we actually need a specialist on this manner here. We've been able to adjust the hips, we've been able to adjust the lumbar, maybe do work on whatever ligaments that we need, but we need someone to be able to work these muscles. And as chiros, we do not have that scope of practice. So I'm really glad that we have you to be able to refer to that as well. Is there any particular times that you've seen where the chiro was not a good idea to have in with the PT care?
For the most part, if I have a patient who's also seeing a chiropractor, most of the time they've been seeing the chiropractor before they come to me.
Right.
We have a couple who regularly refer patients to us because I have a pretty niche specialty. But yeah, for the most part, they've already been within the care of a chiropractor. And
That's awesome.
I find that my patients who are getting treated by both me and a chiro tend to feel better for longer because we're addressing it in two different ways.
Right.
That's the whole point of having these two different positions within healthcare.
Absolutely.
If we did the same exact thing, there wouldn't really be any point.
Right.
So knowing that I have another provider who is taking care of more the joint mobility and the influence of the central nervous system input to the muscles makes my job a lot easier because then I know I don't have to do as much work on that part. I can really focus on what I'm good at. I do treat a lot of people now with hypermobility dysfunction. So either hypermobile Ehlers-Danlos syndrome or hypermobile spectrum disorder.
Yes.
So my patients who already have a lot of joint laxity, most of the time, it's not every single joint in the body. But for patients who have cervical hypermobility or who have craniocervical instability, that's one area that I'm always a little hesitant about with doing high velocity manipulations or adjustments,
Absolutely.
especially around C1, C2, just because of how close it is to the brainstem and the vasculature.
Right.
That's something, if it's already mobile, it
don't
doesn't
need
need to
more.
be adjusted.
Right.
But if that's hypermobile, something else is going to be hypomobile. And that's where I want them to be able to focus on. So for patients who have hypermobility in the cervical spine and or the pelvis, thoracic spine, almost always hypomobile. So they get really stuck either in too much kyphosis or they've lost some of that thoracic kyphosis and their rotation is limited, their extension is limited. And if that's all painful and stiff and uncomfortable, then you're going to get neck pain. There's almost no way around that.
Inevitable, right?
Exactly. So if I can do the training for muscle stability for the hypermobile aspects, I would love for the chiropractor to be able to take care of those hypomobile places.
Absolutely.
And then I can supplement with dry needling, myofascial release, something to just help add to the new mobility that you've been able to give those
Yes,
patients.
Absolutely. No, I love that. And that's a great point on how we have both of our scopes on where we get to be able to play in and do our part, because to be honest, there's not a lot of training to chiropractors for hypermobility issues. We're taught if something ain't moving, make it move.
Right.
You know, so it is important, I feel like, to have that other side of the spectrum. Well, if something is moving too much, how do we get this issue stabilized? So I think that's really important to have those people they can go to and say, okay, this is what we need to do to actually have this work for your body, because everybody's different. I mean,
Exactly.
we see people come in time to time. It's like, well, this person is very rigid, very hypomobile through their entire body, stiff as a board. And then I see somebody else that can pretty much put themselves into a figure eight. You
Exactly.
know? And so seeing that range is so fascinating for me. I've been out in the field now for about 5 years myself, and just being able to have that experience to see that range of what is hypermobility versus what is normal versus what is a hypomobility joint has been really fascinating to see. So I'm glad that you were able to see also people benefiting from the adjustments when performed correctly and done on the areas that actually needed this mobility to be established there. That's awesome. That's awesome.
And I think too, like I got some education in my PT school about hypermobility dysfunction, but I didn't really start to get more education on it until I realized that that was the main issue with my own body.
And when did you come to that realization? How long have you?
I've been consistently now, trying to find providers that can really help my health issues for probably the last 2 years.
Okay.
'Cause my husband and I, we've had a relative timeline on what, like when we wanted to have kids. And I wanted to make sure that my body was in the optimum position in order to be able to sustain that and to do it with as little discomfort as possible. So I've always been a very flexible, bendy person, but never really thought anything of it. And so now looking back to my childhood, though, I've had issues with intense stomach pain since I was a teenager. I've had random allergic reactions to things that were not consistent and would just kind of pop up. I have had struggles with depression and anxiety since I was young, but only in the last 5 or 6 years have really gotten treatment for it, though. ADHD has been a wild issue since I was a kid, and I only just started getting treatment for that when I turned 30. So, and all of these things are very much linked to hypermobility.
Yeah.
It's
Is there anything that they're finding a link to that yet?
Oh, yeah.
Oh yeah. What is
Oh,
it?
yes. So what studies are now finding is that there is a link with hypermobility, which is a connective tissue disorder.
Yeah.
So essentially the linkage between collagen is hyperflexible. So it's not the collagen itself, it's what binds all of those collagen cells together. That results in ligaments and tendons, joint capsules that are stretchier than maybe what the norm is. But that can also be affecting your blood vessels. It can be affecting the connective tissue within your viscera. It's not just the musculoskeletal system. It can be your nervous system as well. So there's a myriad of symptoms that you can see that affect, all these different body systems. And to anyone who's a specialist, they're not looking at all those other body systems. They're just looking at what they know. And they might be missing 4 or 5 other symptoms that when you put it together screams, HSD or HEDS, but that's not what they're taught to be looking for.
Right. Not the bigger picture, maybe.
Exactly. And so I feel like you and I are in unique positions where we're looking at everything from head to toe. We're doing a very comprehensive physical and subjective evaluation, and we're able to see all these different puzzle pieces from the nervous system, the gastrointestinal system, the cardiopulmonary system. Then we can see really if there's a bigger diagnosis that we need to be helping them find. So for me, I don't have a formal diagnosis of hypermobile Ehlers-Danlos syndrome. The only way to get diagnosed with that is with a genetic test. And personally, I just don't have the money to do that right now. So I'm holding off on that.
That was my next question is that what they're seeing now with the EDS is that it's playing more into genetics now?
It is very much a genetic condition. So hypermobile Ehlers-Danlos syndrome is the one subtype of the 13 EDS subtypes that does not yet have the genetic link found. There is active research happening, and I think that they're getting very, very close to finding it and publishing soon. So hopefully that we'll be able to get some more information on that. But when I'm looking at a patient, I'm really looking at the physical signs. So there's a test called the Beighton scale, and it's looking at thumb, pinky, elbow, knee, and pelvis hypermobility. And so if you meet a certain number of those, then you're diagnostically considered to be hypermobile. That could be just a couple of joints. It could be global. And so for me, mine seems to be pretty global. I can dislocate my wrists, my shoulders, sublux, my hips sublux. I've always been really good at like fitting myself into really small places, and I can just kind of like fold up into a little ball, and that's what's comfy for me because my joints need that compression to feel where I am in space. It's affected my cardiopulmonary system though too. I get dizzy when I go from sitting to standing quickly, and I'll see like black spots and my legs give out. I'm now very heat sensitive, and I can't be out in the sun for long periods of time because I feel like I'm gonna pass out. And a lot of these things, I'll ask my patients if they've had experiences with them. They're like, oh yeah, that's happened all the time. I just thought that was normal. Like, what about feeling like you're going to pass out makes you think that's normal?
Yeah.
Because I guarantee you that most people don't feel this.
Right.
But because that's what your everyday experience is, that's what
you know.
exactly. So being able to teach people what's normal and what's not normal, that's something that I've been really, really trying to emphasize, especially for women's health with menstruation problems. I'm giving a lecture on Friday, actually, at a conference for parents of gymnasts on the menstrual cycle, and basically just teaching them that this is something that their daughters need to be paying attention to.
Absolutely.
And if there's something that's off, then that is a sign that they probably need to go get that checked out, because it's a vital sign.
Right.
And
that gets back to prevention. Right?
Exactly.
If you're catching it early,
exactly.
then they can have the education right beforehand as well. Like maybe there's not a quote unquote cure, but at least you now have the education early on, instead of being 30, being like, oh, wow,
Right.
I just lived my whole life not having any idea how to cope, manage, do any of this stuff, when it was a thing that could have been probably managed a little bit better knowing the education beforehand. So I really like that you're
Right.
taking that upper hand and going and stopping people from jumping off the cliff, like we were saying earlier.
Right.
So,
And I mean, I very much think, though, there's no way I would feel, as comfortable as I do, or I feel like be able to do this had I not had these experiences myself. And while, there are some days that I wish that my health was quote unquote normal,
Right.
in a way, I'm kind of happy that
yeah.
I've had these experiences, because I know that this puts me in a very different position to help my patients.
Absolutely.
And
Well, that leads me to my next question. What is there any like health practices in particular that you feel contribute to you being your best in kind of day to day? Anything that you feel like you could even share with most of your patients? Like, this is what I do on my day to day basis, and this is what I found has created a nice longevity of me feeling as best as I can, even though there may be bad days. What leads you to more of those kind of good days? Is there any practices like that?
I think a big thing for me has been taking control of my mental health. That has been, I think, probably the single most helpful thing that has put me both in a better place mentally and physically. As I'm sure you've seen with your practice and your research and education, stress, depression, anxiety, any sort of negative mental health issues will sensitize the nervous system. So that will lead to more intense pain, prolonged pain, a wider area of pain, not being able to localize where that pain is coming from. So if I have a patient who's having, let's say, chronic low back pain, but they've been struggling with anxiety and depression for the last 10 years and it's unmanaged, I can do whatever I need to the spine to help make it feel better.
Right.
But that doesn't mean it's actually going to get any better until the mental health issues are addressed.
Absolutely.
So I've been seeing my therapist now for a little over 4 years, and that has been the single best investment that I have ever made for
Now,
myself.
is that any type of particular like specialist therapist? What type of therapist, if you don't mind?
I went on psychologytoday.com and just read a bunch of bios from different therapists around my area, and I picked the one whose language matched how I thought and spoke.
Awesome.
Because I'm not a very religious person. I am, I would say, spiritual in a sense, in that, I believe in spirits. I believe in that there is likely something after our physical life, but I don't really subscribe to any one thing in particular.
Absolutely.
So I was worried about trying, about seeing someone who was going to try to push those things on me, or push things that I already felt kind of uncomfortable
you just believe
discussing.
This way, all your problems will go
Exactly.
away, I promise.
Exactly.
Yeah,
So
I
the
understand that, absolutely.
language that my therapist used in her bio matched how I spoke. And that made me feel a lot more comfortable. So that was kind of how I picked her, but she doesn't necessarily specialize in like depression specifically or anxiety specifically. But she does work with younger individuals, I would say.
I like that. Okay.
And it's not about, being able to fix your depression or fix your anxiety.
Manage.
It's about being
Coping
comfortable with knowing that you have those things and being able to live your life despite those.
Absolutely.
Being able to recognize how your body responds to stress. And if you can catch those things when they first happen, then maybe that can prevent the spiral or the panic attack that may ensue if you're not able to catch those things. So I think for me, the mental health aspect has by far been the most important and helpful thing, but that also includes regular exercise. Exercise has been shown to be just as effective as a lot of the antidepressant medications that are on the market.
Absolutely.
So if I can get my patients to enjoy whatever type of movement and exercise that is, I don't care what it is that they do.
Right.
I just want some sort of movement.
Find some joy in it so you actually
Exactly.
like to do it, right?
Exactly.
Yeah.
And then that's what's going to help you more. So I've always been very open with my patients with my struggles with my mental health, my struggles with pelvic floor issues, hypermobility, my experience, seeing different healthcare providers and maybe not feeling like I was heard or respected in the way that I felt like I should be. And I think to me, if as a healthcare provider, if I can show my patients that I'm only human and I still struggle with the same things that they do, that really helps the buy-in. And I don't think we should be looked at as like superheroes.
Right, absolutely.
We can't just like wave a magic wand and fix things.
Absolutely.
We all have issues ourselves that we're continuously working on. And
one
that's
of my favorite
the beauty
slogans,
of it, though.
No heroes, no villains. There's only victims. If you have a hero, there's got to be a villain. And if you got a villain, then there's got to be a victim, right?
Right.
So I love that you put it perfectly. It's like, let's not try to be heroes. Let's just be that person. Hey, I've had this formal education, and I also have experience with myself on managing this day to day. Let me allow you to pass that knowledge, education on to you. So that's really beautiful that you're able to do that. That's awesome. Is there anything else that you want to share with us before we get out of here today? I know we got both probably a busy, long week, so I want to get you back to your work week and not tie you up too long.
I think one of the things that I wanted to just kind of put out there, I think there has been a very long-standing stereotype that physical therapists have against chiropractors. With a lot of our education and, just especially with some of the older and more old school practitioners, there's always been this very big divide. I will admit I was totally in that bias while I was in school because I just didn't know.
Right.
And
they're
we
not
got
teaching it there, I'm
right.
sure. Right.
We got a little bit of education on the role of different healthcare providers and what their jobs are, but we didn't necessarily have any one of them specifically come in and lecture us.
Right.
And that's one of the things I think I would love to see changed in all healthcare provider programs, but especially medical school, is just bring in other providers to teach your students what their job is and how they can supplement your patients.
The thing is whether you want them to or not, they're going to be going to them.
Exactly.
Right? So you at least, I feel like, need to be aware of what they're doing. I've personally never done acupuncture. I think it's an amazing thing.
Right.
I think the acupuncturists are great. I've just personally never done it. I was fortunate to be able to learn about that in school a little bit, but also out of school from my patients going to do it.
Exactly.
And it made me aware, okay, this is a thing that people are doing and it's helping them. So at
Right.
least be aware of it, at least know that there is potential for help. So that's a really good point. I'm glad that you kept an open mind, because the politics with the healthcare has always been so funny to me. I remember going to school, and I've always personally loved physical therapy. Before I even consider being a chiropractor, physical therapy called me first. And I started working for a chiropractor, and I started seeing the differences. And I was like, man, the adjustments are really sick. I think I want to be able to do that and also be able to do a little PT on the side. Having been able to have that kind of expertise in the adjustments and having the person to be able to send to for more of the exercise and more dry needling, that kind of thing, I think is phenomenal to be able to do. But I really wanted to thank you for being able to come on here and sharing these amazing stories with us. I really appreciate what you do. And I want you to be able to tell these people out here, where can they find you at if they are in the area local and they are needing some help? Please plug your information and let these people know where they can find you.
Yes. So my Instagram is at Dr. H. Martin. I will admit I am not the most consistent at posting on there because I just personally don't love social media.
Yeah, that's okay.
But I do have some information on there, and I do work at 2 different clinics, but my personal business, I use a sliding payment scale. So I mostly work with individuals who either can't afford to go to another clinic or who have, maxed out their benefits with insurance or who don't have health insurance themselves. And my website for that is persistrehab.com. There's a submission form on there. My email is listed on there. And if anyone has any questions, I would love to chat with you. I've been very lucky, I think, to find a career that I am as passionate about as I am. And I didn't really know if that was going to happen for a long time.
Yeah.
So I'm just happy that I get to share what I love, and hopefully people will get some benefit from it.
Absolutely. I love it. Yeah, no, thank you so much for coming on. It's been amazing to hear this and just to be able to connect all these dots. And I hope people out there listening, I hope this was able to maybe allow you to have some education on your health journey as well. So thank you for taking the time to listen to us, and we'll be looking forward to seeing you on the next one. See you guys.